Well, good evening, Burlington, or whenever you might be watching this. I'm Mayor Marianne Mead Ward, and this is Burlington Matters, where we talk about all kinds of things that are of interest to our community. Feel free to send suggestions and feedback. You can reach me anytime at mayor@burlington.ca. And we have, as always, a stellar panel with us today. We have my colleague, Ward 4 Councillor Shawna Stolte, and we also have, for a return engagement, because he's just really that good, Dr. Dale Kalina, who is the Medical Director of Infection Prevention and Control at Joseph Brant Hospital. And our topic today, all about masks. This week, of course, both the Burlington mask bylaw went into effect on Monday, and the Halton Region mask bylaw went into effect on Wednesday. The two are very complementary, and in fact, Burlington having done, I would say, some heavy lifting, and that's thanks to our councillor Shawna Stolte. A lot of the amendments that we made to craft a made in Burlington mask solution were accepted. All but one were accepted at Halton Region. So really they are effectively the same bylaw. They do work together, and both are necessary. By having our own bylaw, we better control the timing of when it might be lifted or any additional changes that we want to put into our bylaw. So without further ado, I am going to turn it over to Councillor Stolte. She was ahead of all of us, ahead of the curve on this one, saw the need for implementing a mask bylaw. So I just wanted to let Shawna talk to us about what she saw, what she was looking at, and ultimately the two of us brought forward the resolution in Burlington. So go ahead, Councillor Stolte.
Thank you, Mayor. I appreciate those kind words. I am never going to think that I was anywhere near ahead of Dr. Kalina on this. Being a medical professional, I'm quite sure he was probably way far ahead of this than I was. I think at the time when we first started the conversations, and it's going back, I think the conversations probably started maybe 4 or 5 weeks ago, maybe up to 6 weeks ago, when we really started to dig in to see if this was a tool that we really wanted to look at for Burlington and ultimately for Halton. It was after starting to receive a lot of questions from the public about why were we not looking into this, and also I'm a researcher at heart, so I started to look into what other communities were doing, not just in Ontario, not just in Halton, but across the world, around the world, and seeing that there was not definitive research yet. We haven't been involved in this pandemic long enough to get definitive research about the effectiveness of masks in non-medical masks in public, but it certainly seemed that there was anecdotal evidence. I'm not going to use the word evidence. That's not the right word. That's too scientific. That there was just it appeared, is the closest I will come to say, is that in other communities, the communities and countries and provinces that used non-medical masks in public seemed to be controlling outbreaks a little bit better than the communities that weren't. So it just, we look at what other communities are doing, and it was certainly not something that that came out of my head alone. It was just looking and listening and watching and researching and starting to feel as though this was a tool that was possibly coming to be the right tool at the right time for Burlington and Halton. So that's when we started conversations more on council and started to look at how we could implement this. And there was hours and hours and hours that we put in because we wanted to listen to everyone. We listened to many, 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 many voices, hundreds of voices about why this might be necessary, including the voices who were concerned about us potentially doing this. So
absolutely. I would say, and I'm sure you would attest to this, Shawna, that this was probably the single most publicly engaged issue that I've seen in recent memory. Hundreds and hundreds of points of contact to my office. There's, I counted once, there are 17 different ways to reach me. It sounds like a lot, and it is. And people were reaching out on all those platforms, privately, publicly, through email, phone, having conversations. I would say the vast majority, overwhelming, 90, 95% are certainly supportive. And that includes businesses, which we'll come back to what their role in all of this is. But one of the things that folks may not know is that there are different ways to get a mandatory mask bylaw. We've now discovered 3 different ways. So the very first community that implemented a bylaw was Guelph. That was under a Section 22 order by their medical officer of health. That was not a bylaw, and that still stands. The fines for violating that mask order to the business are $5,000 a day. So it's a very big deal. Our medical officer of health chose not to go down that path. The other tool, of course, is a bylaw, and that was something we weren't sure we would have the power actually to enforce over a public health issue. And then municipalities around us and ourselves started looking at the tool through a business licensing bylaw, because we do control that at the local and regional level. So that was ultimately the tool that we used. The third tool, which we've only recently discovered, was instructions that could be given by the medical officer of health to business and could have issued. So, you know, communities around us have used one of those 3 tools. It's a bit of a mix of which one they chose to go with. So we chose the bylaw route. It gives us a little bit more control over what's in it, what the exemptions are. We'll talk about that in a little bit too. But Doctor, I want to come to you about the issue of masks. And one of the questions I hear a lot, and people are pointing to Ontario health websites, Canadian health websites, where it says, you know, the mask is not going to protect you from getting COVID. So the usual sentence that comes after that is, so what's the point of the mask? So talk to us about what the point of the mask is, what it does, what it doesn't do. And we're talking now non-medical masks. Give our watchers some insight into that.
Of course, and thanks again for having me here today as well. So you're very right, and Councillor Stolte is right as well, that there is a bit of a lack of evidence to support non-medical grade masks. There was actually a study that came out a few months ago that was published by some of my colleagues at McMaster, so some local studies that did look at non-medical grade masks, and it found that there's a little bit of a benefit. And where we're looking at that is that, yes, there's a benefit to not spreading the virus, but there's probably a minimal benefit to yourself as well. And when you're thinking about that, you can see that because we know that this virus is spread by droplets, if you're wearing a mask, whether it's a medical grade mask or a non-medical grade mask, the ability to spread it is reduced. Now with those medical grade masks, it's reduced by around 90 to 99%. And in that study, it showed that the reduction in how you can spread that is a little bit lower. But it is certainly one of those tools that we have on our belt to allow us to contain the virus as much as possible. You've mentioned that there are a lot of different tools, both legally, but then also medically as well, that we can use to help reduce that spread. And it's that combination of masking, of contact tracing, and of testing that we're all doing to be able to help keep our community safe.
And the mask does not replace any of the other measures that we've been asking people to follow since the beginning. Is that fair to say?
That's exactly it. And I'm glad you brought that up. There were other studies, and there have been countless studies really around the world that have reinforced that while masks are one tool that we have, the best thing that we have is distance. We know that because it's spread by droplets, they do drop in front of you rather than remaining in the air. And so that distance that we have, and we've been keeping to a 2-meter distance, but the farther away you are, the better, in all honesty. So that's the best tool that we have to keep each other safe, but we can use masks as well. It's a very responsible and kind thing, I think, that we all have for our communities and to help support one another. And in addition to getting tested and staying home when you aren't feeling well.
That's great, thank you. And I know we spent a lot of time looking at and hearing from, as Shawna mentioned earlier, hearing from a variety of voices and built some exemptions into our bylaw. Shawna, walk us through what those exemptions are and where they came from.
Yeah, for sure. I mean, I think right from the start of the conversation, it was very clear that it was important to all of us at City Council that we not assume that that it's easy or comfortable for everyone in the community to wear a mask. And it was really important that we took a look at exemptions first and foremost for under a certain age. We got a little bit caught up in what that age should be because there's some medical research coming out for infants up to 2 years old. There's also just the social challenge of trying to have a 3-year-old wear a mask. So we were debating about the age. We landed somewhere in the 3 to 5 year range, and I think where we landed with the Halton region-wide mask bylaw is at the age of 5, so that there's not the expectation, or it's left up to parents to decide whether or not they feel as though they can encourage their child under the age of 5 to wear a mask, but that needs to be kind of a parental decision. The other exemptions were more based around physical issues. If you have, if it truly you have a physical issue where it's going to exacerbate that medical condition by wearing a mask, we certainly don't want the mask wearing to put people at physical risk. So we needed to exempt anyone who has a physical condition that would prevent them from wearing a mask safely. But we also had a long conversation and talked about people with perhaps developmental challenges or other physical disabilities like the hearing impaired, who they would not be able to enjoy being out in the community and communicating effectively with their face covered, or they wouldn't be able to necessarily be able to read the lips of someone who they're trying to communicate with if their face was covered. People with perhaps autism, people with a lot of different emotional or mental health challenges, that wearing a mask could really impact their enjoyment of their day-to-day life and their ability to engage in the community. So we wanted to take a look at those, and sometimes the conversation got really specific, and then we kind of pulled back a little bit to say, I think we can have some overreaching exemptions that can cover the majority of people that would really have a negative impact by wearing a mask. And then at the regional level, we ended up with much less exemptions because we landed on one that was kind of an umbrella exemption that covered all of those. And we clarified at the region that any specific exemptions that Burlington chose to spell out would be covered under the bigger exemption of the region. So we were just trying to be conscious of the fact that this was not going to be the answer for everyone, and to be trying to appeal to the community too, to be patient and kind, as Dr. Kalina mentioned, to be patient and kind with each other, that there could be very well either a very visible or a not visible reason why somebody just can't wear a mask, and that we need to be aware of that and not judge people and not be pointing fingers or hassling someone. That remember that we're all trying to do our best. We're all in this together. We're all trying to get through this together the best we can.
Mm-hmm. Kindness is key here. Kindness, understanding, and doing whatever you can to protect your own health and that of your community. Yeah. One of the things that we also built into our bylaw, which is in bylaws that we looked at in other municipalities, is that two things. You don't have to show proof of an exemption. That is not a requirement in our bylaw. And you can enter a store without showing that proof. However, businesses do have the right to set their own additional conditions over and above the bylaw. That's really important. I have started to receive feedback from community members that, notwithstanding they have an exemption and that is covered in our bylaw, that you can proceed if you have an exemption. And you don't need to show proof, but businesses do set their own standards. So it's very similar to the no shirt, no shoes, no service previously, that businesses could restrict and take additional restrictive measures on top of our bylaw, and some are doing that and not allowing entry if you don't have a mask on. However, what I have heard also is businesses are really trying hard to accommodate folks who can't wear a mask but still want to get a service or a good, and so they're helping to facilitate online shopping. They're doing curbside pickup, so you order. If you've got a phone, you can order and they will bring it out to you, so you don't need to come into the store. So it's really important to clarify to folks that, notwithstanding the exemptions in our bylaw, businesses have always had and still do have the right to set additional measures, including things like limiting the number of people in the store. Obviously, they set their own hours. So those kinds of things are over and above our bylaw. Doctor, I wanted to come back to you because we had quite a discussion about face shields. And that is one area of difference between the Burlington bylaw and the Halton Region bylaw. and that is that we allowed face shields to be worn or masks. And I know there's some discussion and concern about the effectiveness of face shields, but that is how our bylaw stands here in Burlington, and so that is acceptable. So talk to us about the value of face shields. Do they protect as well as masks? When should they be worn?
So at the end of the day, I think that the ability to use a face shield in place of a face mask is a great opportunity to allow for accessibility for that protective equipment. Because people that really can't wear a face shield for medical reasons, who can't wear a face mask for medical reasons, oftentimes they're respiratory in nature, and being able to wear a face shield will still offer a degree of protection without wearing that mask. Now, because the face shield itself is a little bit farther away from the face, it offers a different type of protection. And I think it's a little bit more protected for yourself than it is for those around us. But that said, it is part of what we wear at the hospital, for instance. I can tell you from personal experience, it is far more comfortable to wear a face mask for an extended period of time than it is to wear a face shield. Face shields are somewhat difficult to be heard in and to hear in, but they're kind of uncomfortable. At the end of the day, I think either are very helpful, but again, we don't have that level of evidence to show us just how helpful a face shield would be. I think it helps, I think it contributes, and I think that it's certainly something that everybody can do if they're not able to wear a face mask to help protect everybody around themselves and also themselves.
That's great. And one of the questions I've gotten is what is not covered in our bylaw. Hospitals and schools are not covered, and I'll come to you about your policy, Doctor, and also let Shawna speak to apartments and condos, which we've heard a lot about. So what is the policy at the hospital? We don't regulate hospitals. We don't regulate schools. We don't have authority. Our bylaw. We were able to get our bylaw in because it's a business licensing bylaw, so it only applies to commercial establishments, not anything else. So what is the hospital doing around mandatory masks?
Of course. So at Joseph Brant Hospital, we actually were one of the first hospitals out of the gate back in early March to implement a mandatory masking policy for all patients and visitors. So that policy was in effect for the duration of the height of the pandemic and the height of the surge. But you may know that a few weeks ago, we did have a discussion and changed our policy to allow for individuals to wear masks from home. And in doing that, what we did is asked individuals and strongly encouraged wearing masks, whether they be a mask from home or a mask that we provide at the hospital. During that time, which was about a week, we actually had 100% of our patients and visitors wearing masks. It just goes to show how much support we have for one another here in our community. Recognizing that we did have some evidence to support mandatory masking and recognizing how important it is for how we control masking in the future as we see a second wave, we did make that change to mandate masks to be worn by all visitors and patients when they come into the hospital. If you don't have your own mask, we're happy to provide one to you, but it is mandatory at this time.
And our bylaw doesn't cover apartments and condos. I'm hearing a lot about that. I'm sure you are too. Shawna, what are we collectively doing about that piece?
Well, that's been an interesting one, because realistically, our mandatory mask bylaw does not cover people who are in their own private residences. And when it comes to condominium buildings, especially, when you buy a condo, part of your purchase price is covering shared joint ownership over those common spaces, and those are considered still part of a private residence inside that building. So it does cross both areas. It is a public space inside a private residence. So it's been a bit tricky, and our bylaw does not at this point cover that. And we were given the impression that we did not necessarily have a tool to have the authority in there. But we've certainly heard from a lot of members of the public, because there are a lot, especially of our older population, who live in condos and apartment buildings, who are concerned about that shared space, shared laundry rooms, shared elevators. So we've reached out to both our the legal teams, both at the City of Burlington and at the region, as well as reached out to, I think it was yesterday yourself, Mayor, sent some letters to the Halton or Burlington Condo Association, as well as the Apartment Association that covers apartment buildings, just to initially ask for their assistance on how to manage this particularly sticky piece of mandatory masking. And, you know, we're getting, that one seems to be a little bit more from my end 50-50 as far as people feeling as though we really shouldn't be sticking our nose into private residential space, and as many people saying, yes, please stick your nose into private residential space when it comes to the condos. So we're going to have to do a little more digging to figure that one out.
And we are hoping to get a report back from our Halton regional staff in August at our next meeting to see whether or not we would even have the legal ability. It is unclear, and they are looking into that a little further at council's request. And it is a touchy area. It's a private residence with a public area, right? And so it's that public piece that that certainly I've heard a lot, including today another email asking about what we could do. So right now I've sent letters asking asking the apartment and condo associations to work with their members to voluntarily bring in their own policies, which they would have the ability to do right now. Shifting gears just a little bit, Doctor, you talked about the contact tracing and testing, and I know there's some changes that are coming up in our ability to do some testing. Talk to us a little bit about that.
I'd be very happy to. So at Joseph Brant Hospital, we've been operating an assessment center since the early stages of the pandemic. And throughout this time period, we can see as the testing guidelines did expand, we've been able to keep up as much as possible with the demand, but recognizing that we can do a little bit more, I think, to support our community, especially through the summer months. We've been able to develop a project so that we do have a drive-through assessment center. So this is being announced on Friday and will be going live this week, in addition to an online booking system and the ability for all of our results to be accessed through the online platform. So it's a lot of work that's gone on behind the scenes over the course of the past several months, and a lot of cooperation between us at the hospital, the Burlington health teams, the Ontario health regions as well, to be able to develop this system to be able to support our community. So it's something we're very excited about, to continue to support the community, especially through the summer months, while we work with all of our regional partners to develop a long-term solution to how we can make sure that we do all that testing and then can allow for that contact tracing to keep as many people safe as possible.
You know, that's really essential. It's such great news for the community because I've certainly heard the demand for testing has gone up, especially as people get back to work. For some of them, it's a requirement to be tested. And so the volume's gone up. So I think this will really help to expedite those tests so people can get out and about. You know, especially as we enter stage 3, which we also did today at 12:01 on Friday morning. And I don't know about the two of you. I have very mixed feelings about that. I think some of our businesses are certainly happy to get in business, and to the degree that they can operate safely, protect their customers, protect their visitors and guests, then and their employees, that's a great thing. But there are, the increase in gathering sizes, bars opening. We really need that contact tracing and testing to stay control of this. And also the masks come back into that equation. It was one of the reasons when I was asked, why now? Why are we doing it now? Well, the emerging evidence around asymptomatic transmission. You wear a mask to protect others from you. The emerging, evidence or information that we could actually pass a bylaw. That wasn't clear at the very beginning. In fact, we were told no, that we couldn't. But here we are, and just being prepared for people getting back into many more activities. Back to you, a good news story on masks, Shawna. If people need one, they can get one for free. So talk to us about, and you've been spearheading that as well. Talk to us about where they can get a free mask and what we're doing about that.
Okay, so I think it was important to both of us as we were pushing forward with this mask bylaw that if we were going to expect the community to get on board with this, that we also had a responsibility to ensure that people had access to masks. And there's reasons, number of reasons, multiple reasons why somebody may have a hard time getting their hand on a mask. So it was important to us, and we did create a fund through the bylaw that allowed for the City of Burlington to procure masks to be available to the public. We also started up a system that's been really fun, is reaching out to our business community to ask the business community if they would be in a position to donate masks to the cause and make sure that people around Burlington had access to masks. And that's been very well received. Two of my daughters and I had fun last Friday. We had the pleasure of going over to the Canadian Tire on Fairview Street and picking up what I thought was 1,400 masks. It turns out I was missing a zero, and it was actually 14,000 masks that we picked up that day. So that was, I felt like Santa Claus bringing those back to City Hall. Now they are disposable masks. It wasn't our first choice, but we are certainly more than thrilled that Canadian Tire was able to help us out with that. So those are actually here at City Hall right now. We have packages of 20. So if you were to come down to City Hall at any time that it's open, and it started being open this past Monday, you can pick up at the front door a pack of 20 disposable masks. That's going to get us through in the time being. We've also are waiting for what I believe procurement yesterday told me was about 2,700 reusable cloth masks that we are waiting on a delivery on, that we're hoping will be here, and that we'll be able to get those packaged up and quarantined in a safe way, so that when people take one home, they know that it's been safely quarantined and been touch-free for many days and clean and so on, and they'll hopefully be available next week at City Hall. We've also reached out to the public library system, Burlington Public Library, in hopes that they're going to be able to distribute them through each of the public library branches, because we want to make sure that it's accessible to everyone in all corners of Burlington. So that's what we're working on at this point.
Well, that's a great place to end our show. We are out of time. I want to give a special thanks to Dr. Dale Kalina, who's the Director of Infection Prevention and Control at Joseph Brant Hospital. Of course, my colleague, Ward 4 Councillor Shawna Stolte, for the All About Masks edition of Burlington Matters. If you need to reach me with any comments or questions, please reach out to mayor@burlington.ca. Good night.